219 to 212. Joining me now, two members of Congress, Republican Darrell Issa of California and Democrat Debbie Wasserman Schultz of Florida. Congressman Issa, it's a huge setback for the Republicans right now.
Well, it's certainly one that we expected. We expected to lose. What we didn't expect, quite candidly, was to be shut out of the process from the very beginning all the way through today when the Rules Committee considered yesterday and into the night 80 amendments, none being allowed to even be considered on the floor.
Why did you do that, Congressman Debbie Wasserman Schultz?
That is just a brazenly false statement. From the very beginning,
Is it like you lie?
No, it's a brazenly false statement.
It's true. We submitted 80 amendments.
With all due respect, there are 200 amendments that were offered and accepted by Republicans, accepted by Democrats, incorporated into this bill. This is a bill that is bipartisan in content, unfortunately not bipartisan in the outcome of the vote. We gave every opportunity over and over again. The American people saw President Obama extend his hand, saw Speaker Pelosi and Majority Leader Reid ask Republicans repeatedly to sit down with us at the negotiating table, and we were repeatedly rejected. The American people deserve this vote tonight.
First of all, we were never invited to the table. The closest we had was when the president came to the retreat and told us Paul Ryan had some very good ideas, certainly told Jason Chaffetz, well, maybe we should break this up into parts we could agree on and vote for, something that we wanted. So, and, you know, look, I've served in committee with Debbie for a long time. In committee, if you say, we'll accept this amendment or that amendment, that's nice. But before the entire floor, asking for things that maybe a committee shut down and didn't accept is typical. It is very unusual of any piece of legislation, including the two major pieces of legislation that the Speaker talked about, Social Security and Medicare. These were not put out with no amendments allowed on the House floor. They certainly were not put out in this way.
It is fair to say, Congressman Debbie Wasserman Schultz, that for a major piece of social legislation and health care reform, they've been working on this for decades, as you know, to pass it without any Republican support is extraordinary, because Social Security or Medicare or the civil rights legislation, there was bipartisan support.
It passed without any Republican support by their choice. In fact, former President Bush's own speechwriter tonight, David Frum, wrote an essay talking about how the Republicans passed up an incredible opportunity to sit down after being offered over and over again to compromise. He pointed out that this legislation is very close to Mitt Romney's proposal on health care reform. He also pointed out that they have blown this historic opportunity to reach consensus with Democrats. So if there was any exclusion, it was self-exclusion.
So, Congressman Issa, where do you go from here? The president's going to sign this health care reform into law within the next 72 hours, let's say by Tuesday. The Senate will consider the changes in the reconciliation bill. Where do the House Republicans go from here?
Well, I think it's very clear that Americans should prepare to pay $560 billion of additional taxes. People should expect their capital gains to go up to 23+%, a 60% increase in the capital gains rate. These are certain. Will there be some ways to take failed portions and fix them? In the future, will we be able to take some parts that were not included and get them included? I hope so, either under this president or a future president. But what we really have here tonight is we have a time in which the American people said, get the economy right, get us competitive again, get jobs. And instead, we have a huge tax increase now and a huge offer of benefits starting in 4 years, none of which is going to get America more competitive. Wolf, we have to make America more competitive. Canada spends half as much on health care as we spend, and yet this bill actually will raise the cost of health care, not lower it.
Very quickly, because I want to take a break.
What's going to happen in the next 90 days to 6 months, people will finally see that insurance companies can't drop them when they're sick anymore. Children are going to be able to be covered and not excluded for a pre-existing condition. We're going to close the Medicare Part D donut hole and finally make sure that seniors get affordable prescription drugs. And we're going to pass, and we've passed the largest tax cut for small businesses in American history so they can provide insurance to their employees and not be forced to choose between laying them off and providing them with benefits.
All right, I want both of you to stand by, because we're going to continue this conversation. Lots more to discuss, including someone, we don't know who, someone shouting out baby killer at Democratic Congressman Bart Stupak of Michigan. Our assessment of what's going on with these two members of Congress will resume right after 2 million Americans health insurance.
What I said before the break still goes. We cannot afford to do health care reform wrong to go up in cost rather than down in cost. It's very clear that there are things that we agree on. Certainly creating large pool capability so that the same health care that I enjoy, that Debbie enjoys, where we have no pre-existing condition, no age discrimination and so on, I pay the same amount as somebody younger or older than me within the federal workers pool. That is a reasonable goal that could have been
the law of the land, though.
And that certainly could have been achieved. But let's remember that there's going to be a lot of gaming in this system. First of all, someone can choose to pay 2% if that's a better deal than actually having insurance. You've got people that will only pay $700 for the penalty for not having it. There's a lot of questions there. What we do know is taxes are going up. Not only does nothing in this bill drive down the cost of health care overall, but there actually are new loopholes in tort, so there'll be more suits.
You represent a district in Florida, including Hollywood, Florida. A lot of seniors live down there. I've been getting a lot of emails from many seniors who are worried about their beloved Medicare because this legislation will cut in growth, Medicare growth, $500 billion over the next 10 years. That's $50 billion a year. How do you cut that kind of Medicare expenditure without reducing benefits for seniors?
We are absolutely not reducing benefits. In fact, seniors who on Medicare will see improvements in Medicare. Again, by closing the Part D prescription drug donut hole, by making sure that we get rid of deductibles and co-pays for preventative care. It is going to be easier to focus on health and wellness for seniors instead of the Medicare system, which has always been treated as a sick care system where seniors only go when they are feeling ill. I mean, just because Darrell says it doesn't make it true. This is legislation that will give $143 billion in deficit reduction and also add 9 years of solvency to Medicare, which is hugely important for seniors.
Only in Washington do we call it deficit reduction when we have $1 trillion in new taxes and $500 billion of cuts, and then we say, well, it's neutral. The fact is this is a large tax increase, and the claims under Republicans and Democrats that in the future we're going to save money on Medicare have never come to pass.
We're almost out of time, but we're almost out of time, and I want you to weigh in, both of you to weigh in. Were you there when you heard someone, I don't know who it was, screaming out "baby killer" at Congressman Bart Stupak?
I was off the floor, but I did hear the recording you just played, and I denounce whoever said it. I certainly hope that if someone said it on the floor, that it was a staff person or someone in the gallery. But if it was a member of Congress, I absolutely would denounce it.
Because you know Bart Stupak, and he's firmly against abortion.
Well, it doesn't matter whether you agree or disagree with somebody making a statement. We are a place where decorum historically is maintained, and that includes the statement that you mentioned earlier about, well, the president was speaking. Quite frankly, it includes the president calling the justices out when he was a guest of the House. We've got to get back to the expectations of the people in the House of Representatives, and it has certainly failed to be reached.
As someone who supports a woman's right to have an abortion, how worried are you about this whole colloquy and the executive order the president will sign, basically saying there will be no funding, federal funding for abortion?
As a pro-choice member of Congress, I think that we have simply maintained the status quo, not allowed for federal funds to pay for abortion coverage, and not changed in either direction the way we handle abortion coverage. And look, at the end of the day, Wolf, this legislation, anytime you can cover 32 million Americans and get $143 billion in deficit reduction, it's a win-win for the American people. That's what this bill will be.
The American people will have a chance to assess it over the next several weeks.